Okay, before we get started, I wanted to go over, I'm sure you've seen the logo about the Wasatch Sleep Dental Clinic. I just want to explain a little bit what that is. I'll introduce it more later, but this is a dental clinic that's focused on sleep issues in children and adults. And so here are some of the services that we offer at the sleep clinic. We obviously do HealthyStart. We also do sleep apnea dental appliances for adults, and we do snoring devices. Not quite at the same level as a sleep apnea dental appliance. We do night guards, and we do Botox therapy for the bite force reduction. And HealthyStart, if you've watched the videos that I sent you, know that HealthyStart fits in that category because it is an alternative to braces and it does straighten teeth, but it also addresses some sleep issues as well in your kids, which makes the program so powerful. But the sleep clinic is in addition to I have a normal dental practice. And both of these are in Riverton. We're in the process of moving right now, but right now we're on 126th and Bangerter, right next to the In-N-Out Burger. And then when we move, we're just going to be moving directly south to 134th South. You've gotten a great introduction at this point to HealthyStart. I'm excited to talk about it more. I wanted to let you know that at a certain point in the webinar, there'll be a button that shows up that says claim your offer. There'll be an offer that you will get $500 off the HealthyStart treatment for your time. For your time in watching the videos that I sent you, for your time in watching the webinar, for becoming an educated patient for the HealthyStart system. And that creates a lot of value to me for you being a patient of mine, that you are willing to go through and take a little bit of your time and to learn about this system. And so I want to thank you in advance for doing that. Now, I've got a question for you. How many of you have even heard of HealthyStart before I introduced it to you? Probably not very many of you. County dental school, I've been in the dental field for 14 years, and in all of that time, I had never heard of HealthyStart until a dental school buddy of mine introduced it to me. He has his own dental practice in Colorado. Now, it's not a treatment option that many people in Utah have heard of, but we are going to change that. Now, I think the first thing that piques somebody's interest about HealthyStart, someone that's never heard of it before, is just the fact that it's an alternative to braces. Now, sorry about this picture, it's a little gross, but so are braces, and we'll get into that later. But in the US, braces have become pretty popular, and I would say even commonplace. Most of my patients had braces growing up, and I looked it up, and about 4 million people in the United States are in braces at any given time. Now, I didn't have braces growing up, but I got them in dental school when I was 25. I went to dental school in Milwaukee at Marquette. Now, amazingly, I was able to find some models of what my teeth looked like before braces, and as you can see, my top teeth were pretty straight, but my lower teeth, they were pretty crooked. Here's one. And they were getting worse as the years went by. One of my lower front teeth, my older brother growing up affectionately named Sears Tower because it was a lot taller than my other teeth. It's also been called Snaggletooth and Old Chompy, all affectionately, of course. Most of the time my lower teeth were covered and not very visible, so I didn't worry much about it. But then I got married, and my wife, well, she married me and Chompy, so it must not have been a deal breaker for her, but she did point out that when I laughed or when I would sing, it was pretty visible. And yes, another thing I'm passionate about besides HealthyStart is singing. I give you a little hint about where I am in the picture, but any guesses on the name of the choir I belong to? I'll answer that later on in the webinar. So during the last 2 years of dental school, I had braces. This is a picture of me and my lovely wife taken about 10 years ago when I was close to finishing dental school. Now, how can you tell that I had braces? Because I'm not smiling. My wife was always trying to get me to smile with the braces, but I rarely did. So here we are freezing our butts off at a BYU game soon after the braces came off. My teeth were quote-unquote fixed, and my Sears Tower became just as tall as the other buildings around it, and I had an overbite and a deep bite that was fixed as well. But here's the thing. Just like many of you, I wasn't great at wearing my retainer, and after a few years, things started drifting back to where they were. Sears Tower hasn't come back because I have a permanent retainer on my lower teeth. A permanent retainer, real quick, is a wire they put in the back of the teeth to keep them in line. It's also called a bonded retainer. But I have had many patients where their permanent retainer has popped off, and with our busy lives, most patients can't get in right away, and it doesn't take long, a few weeks, sometimes as little as a few days, and the teeth have shifted. Or others like me just didn't wear the retainer very well and then their teeth relapsed. It's a point of frustration for many people, and now as adults they want to do something about it, so we usually treat it with some clear orthodontic aligners, an Invisalign type treatment that we do in-house. So compromise number 1 is retention. But why with braces do we have to worry so much about retention? Why do these teeth so readily want to move back to where they were? The answer is because most of the time we get braces after all of our permanent teeth have grown in. The supporting structures of the teeth, like the ligaments, which are like vines that surround the tooth and hold it in place, because there are large forces at play when we bite and chew our food. These ligaments are fully developed and their quote-unquote home position is set. Now the teeth can be moved after this point with braces, but it's like a wind-up toy. Those teeth are always going to want to move back to their home position. This is why retention after braces is such a huge deal in the first place, because if not, and many of my patients have learned from sad experience, their teeth will go back to where they were. Okay, so one of the great things about HealthyStart is that they think about things differently. They ask the question, why not start earlier and guide the teeth in place as they are erupting? If the teeth can be guided in place while they're coming in before the home position has been set, then theoretically retention won't be a concern anymore. And you know what? They've been proven right. When teeth are guided into place while erupting, retention just isn't a concern. Now, how many of you think that this is way cool? I know I do, and to me it just makes sense. And that is one thing you will continue to find about HealthyStart is that how they go about things, it's just intuitive. Now you may be wondering the point of this slide, and other than an excuse to tell you that mint chocolate chip ice cream is my wife's favorite, is that they are all cool, just like HealthyStart. And yes, I'm expecting some eye rolls at this point. So I have about 50 patients right now with traditional braces. For those of you that have had braces, you already know how difficult it is to keep the teeth clean with all of that extra metal in there. The braces trap food, plaque, and everything else, and as this extra material coats the teeth and the gums, it can wreak havoc in the mouth. The result is that when we go to take someone's brackets off, they often have puffy gums, white spots on their teeth, or cavities. Now this puts a damper on what should be just a happy day. I have had a couple times that I needed to take off all the brackets prematurely because the patient would come in literally with their teeth full of a fuzzy coat of plaque. And there does come a time where braces are not worth the damage that is being done to the teeth. Now, speaking of fuzzy coat, and it's definitely a cuter image than actually showing teeth covered in plaque, I think you'll agree. And it's a bear wearing a coat. You can't get much fuzzier and coatier than this. Alright, back to the teeth. With brackets that we have to take off because of the fuzzy coat scenario, we don't put the brackets back on until they can show us a vast improvement in their home care. But from what I have seen with my patients, that it is the rare kid that takes care of their teeth like they should. So in turn, it is a rare kid that gets their braces taken off without any ill effects on their gums or teeth. Thanks, Bear Buddy. So compromise number 2 is home care. Braces make it much harder to care for your teeth with lasting consequences. This is a big advantage for HealthyStart because kids are not at an automatic disadvantage with a bunch of extra metal in their mouth. They brush and floss as usual. And yes, you can request different colors for the mouthpiece. This girl evidently requested red. And just look at these cute mouthpiece containers. If that doesn't convince you, then I don't know what will. With HealthyStart, your kids won't have brackets that are great at catching Krispy Kreme donuts, and that doesn't look like a Krispy Kreme, or Oreo cookies, or anyone know who this is? Yep, it's Little Debbie. I love me some Swiss cake rolls. There's also crackers, breads, and pretty much everything else that is put in the mouth can get caught in the braces. But not a problem with Healthy Start. Now you still need to brush and floss properly, especially if you decide to indulge. But isn't this a huge advantage? Now for some parents, talking about growth, retention, and being able to avoid puffy gums, white spot lesions, and cavities with braces, just talking about these things is enough for them. For a lot of my patients, when I start talking about Healthy Start, I get excited and I find myself telling them everything, all the benefits. And they're like, you had me at guiding the teeth when they are coming in. Have you guys seen Jerry Maguire? But I can't help myself but tell them everything. It's funny because sometimes in my practice, I catch something in my patient's eye, like, you've never talked to me this long about anything before. What can I say? I love this treatment. Now, for those of you that are already convinced, I'm happy about that, but there are some other major benefits to Healthy Start that we need to talk about. They can be the icing on the cake for some of you, but I would consider them the meat and the heart of Healthy Start treatment. Now, when my friends started talking to me about Healthy Start and their concept of starting treatment earlier and utilizing growth, I was interested. But when he started talking to me about sleep-disordered breathing and Healthy Start, I knew I had to provide this treatment for my patients. This information hit me personally. He told me about some of the symptoms of sleep-disordered breathing, and 2 of these symptoms stood out immediately: snoring and bedwetting. I have a daughter that snores. My daughter would wake up tired, and it seemed to take a little while for her to get going in the morning. And my son has had a bedwetting problem off and on since he was potty trained, and it has caused some concern, especially when we want to go on vacation with him, or when I would want to go camping. After learning about sleep-disordered breathing and that 90% of children suffer from at least one symptom related to sleep-disordered breathing, I wondered if this was the underlying cause of these symptoms in my children. I started them both on the habit corrector, the first appliance in the Healthy Start system, and these problems vanished. Both of these problems were caused by a lack of good quality sleep. My son, when he first got the habit corrector, I asked him how it was going. He said, "I don't like this thing, Dad." So I asked him what he didn't like about it, and he said, "There are 2 spikes that hurt my tongue, and I want to put my tongue there, so I don't like it, and I don't want to wear it." And so I explained to him that there is a much better place for his tongue, and the appliance is trying to help him find that spot. But inwardly, I'm thanking my friend for telling me about this program, because my son now has the opportunity to greatly improve his growth, appearance, and sleep by not having a tongue thrust. So one more family member, let me tell you about my nephew that just got the habit corrector. His mom says that he is great at wearing the habit corrector for a while, but then all of a sudden he takes it out and yells, "I just want to breathe through my mouth." Then he takes a moment, puts the appliance back in his mouth, and then goes back to what he is doing. But I think this is great because I know that my nephew can get healthier by getting rid of what could turn into a very detrimental habit, mouth breathing. So now I get to show you my very favorite chart about sleep-disordered breathing. It outlines everything into 3 main sections and organizes things in a way that is easy to understand, and we'll be referencing it quite a bit. We are going to focus on the compromised airway section. These are all conditions in the mouth that can compromise the airway. I already briefly mentioned 2 of them: mouth breathing and a tongue thrust. I outlined those both pretty well in one of the videos I sent you. It's the second one called Forward Thinking. So if you need a reviewer, just go back and look at that video. So really the only condition that wasn't covered in the video was crowded teeth, and this one is simple to explain. The main concept is that crowded teeth gives the tongue less room to work with and can force the tongue forward against the teeth, or in other words, causing a tongue thrust. A tongue thrust in turn narrows the dental arch and constricts the airway. Okay, we reviewed all the bad habits or conditions that can cause sleep-disordered breathing, but let's get back to the symptoms of SDB. Now, a really good review of these symptoms is in that 3rd video that I sent you. But we're going to go into some of them a little more detail. The first one is going to be ADD or ADHD. I'm going to refer to it as just ADD. And it's a well-known disorder because of its prevalence. It's also involved in education, and it is sometimes medicated, and there's some controversy on whether it should be. But treating with medication should be understood as just a temporary solution, definitely not a permanent solution to whatever is the underlying cause. And have you ever wondered what that underlying cause was for those parents that have children with ADD? Now, a lot of a prevailing theme in the past has been sugar. And I am a dentist, and so sugar is an enemy. It's enemy number one for tooth decay. But as far as ADD, there's been no evidence that links sugar as a cause of ADD. Now, that doesn't mean that you can let your kids go hog wild. It is still a cause of cavities. My 4-year-old son, the one that had 8 cavities that I had to fix last month, that was a lot of fun. He can attest to this. He was a master at sneaking candy, and I shouldn't say was. Other explanations are too much TV or even bad parenting. But the problem is that none of these potential causes are supported by research. But studies have shown that after sleep-disordered breathing is treated with HealthyStart, many of the symptoms of ADD disappear because HealthyStart could very well be treating the underlying cause. Let's go back to the chart. Let's review some of the other symptoms of SDB. So chronic allergies is on here, but it can actually be allergies, eczema, and asthma, and they can all be caused by sleep-disordered breathing. I couldn't really find out a lot on why this was, but my best guess is getting poor sleep day after day can trigger some autoimmune responses in children with sleep-disordered breathing. Another very common symptom of sleep-disordered breathing is night terrors. This chart says nightmares, but I think that listing night terrors would be more correct. In fact, you may be asking yourself, what is the difference between nightmares and night terrors? I asked the same question when I was first learning about SDB. Here's the difference. Nightmares are dreams with vivid content that occur during REM sleep. They usually involve awakening and good recall of the dream. Night or sleep terrors are often described as extreme nightmares that take place during non-REM sleep. They usually include agitation, large pupils, sweating, increased blood pressure, screaming, and appearance of being terrified. Parents are awakened, but the child does not usually wake up and doesn't remember anything in the morning. A typical cause of night terrors is sleep-related breathing disorders, or SDB. When a child's brain is not receiving proper oxygen at night while they are asleep, night terrors is just one of the many symptoms. Because HealthyStart can widen the airway and improve the quality of sleep at night, it can eliminate night terrors. Okay, lower IQ and difficulty in school. Children without proper REM sleep and lack of the necessary oxygen to their brain while sleeping have trouble in academics, and studies have shown that the subjects most affected are spelling, math, and science. HealthyStart helps the brain work better by helping to feed it the oxygen it needs. I think now is a good time to give you a little bit more of an introduction about myself. I was born and raised in St. Louis, Missouri, and here's the famous St. Louis Arch. I went to BYU and majored in exercise science. While there, I met my beautiful wife, Mandy. We have 4 rugrats together, but they are older, so I guess they are mall rats. But they don't go to the mall, so maybe they're just kids. They range in age from 5 to 14, and they are a lot of fun. As I already mentioned, I went to dental school in Marquette in Milwaukee, Wisconsin. And yes, it is very cold there. I got a job as an associate dentist in a private practice, which took us back to Utah. And in 2010, I started my own practice. It's called River Crossing Dental. I have been doing traditional braces for about 5 years now. My first patient was my mother-in-law. Talk about pressure. Her teeth are just lovely now. And I started a dental clinic focused on sleep disorders last year. It's called the Wasatch Sleep Dental Clinic. Initially, we just started working with adults with sleep apnea. And let's talk about that for a minute because it can help explain our next SDB symptom. I created a video soon after I started the sleep clinic that I think will introduce our next topic perfectly.
Hi, I'm Dr. John Peterson. Let's talk about sleep apnea, dentistry. You may be thinking, what does dentistry have to do with sleep apnea? Quite a bit, actually. There is a relationship between sleep apnea and grinding your teeth at night. Grinding your teeth is the body's way of 1, trying to wake itself up to start breathing again, and 2, to move the jaw forward to help open up the airway. The traditional way of treating sleep apnea is a CPAP. Now, if your sleep apnea is severe, then a CPAP is necessary. But if you have mild or moderate sleep apnea, then a dental appliance is actually the better treatment for you. A sleep apnea dental appliance is something you wear in your mouth like a retainer that moves your lower jaw forward. This opens up your airway, but the appliance has the added benefit of treating the grinding problem as well. Call Wasatch Sleep Dental Clinic for more information.
So the reason this relates to sleep disordered breathing is that another symptom of SDB is teeth grinding, because the same cycle is happening. The child is grinding at night to help move the lower jaw forward and maybe to help wake the body up if it's getting bad enough. Now this is very pertinent to our conversation about sleep disordered breathing in children, because the pathway of getting diagnosed with severe adult sleep apnea, where the only treatment is use of a CPAP, is one possible outcome of not solving the problem earlier in life. HealthyStart can correct the root cause of sleep apnea, which I think is awesome. So I was just going to quickly mention some symptoms on the list because I think they are kind of obvious when we were talking about sleep disorders. Restless sleep, frequently waking up at night, and daytime drowsiness. So there you go, I mentioned it. And with aggression, defiance, and anger, I think I covered this one pretty well in the video clip, so moving right along to bedwetting. I mentioned it briefly when I was talking about my son, but this was an interesting topic for me because I was completely wrong in my initial line of thinking. I always thought that bedwetting happened because of too deep a sleep, so deep in fact that control of the bladder is lost. But even though this is what intuitively made sense to me and maybe is what you had thought as well, too deep of a sleep is not the cause of bedwetting. The true cause is that there is a part of the brain that helps kids that are struggling to breathe, help them breathe. The problem is that the same part of the brain controls bedwetting. So when a child with sleep disordered breathing, both are trying to compete for the attention of this part of the brain. Well, the breathing is going to win out every time at the expense of controlling the bladder. Since the habit corrector helps open up the airway while the child sleeps, the brain can focus on controlling the bladder. And then magically, well not really, I just explained the science behind it, but magically, the bedwetting problem is gone. The last symptoms I wanted to talk about are snoring and dark circles under the eyes. Snoring is a partial blockage of the airway, usually from the tongue or the tonsils. And I love the HealthyStart exam because it is very thorough. We even look at the tonsils to see if they are enlarged. Dark circles, or the technical term is venous pooling, which I think sounds kind of cool, is also a symptom of SDB because those appear in children that are not getting quality sleep at night. So those are things to be on the lookout for. Okay, initially in the video, we spent some time on this top left section called the underdeveloped dental arches and jaws. And I think it's fascinating information, but I'm actually going to send you an email with me talking about some of these things. And it's a video that you can watch. I think it is helpful to kind of understand earlier on, before the age of 6, when we can actually start treating with HealthyStart, why some of these things are happening. And the main topics are going to be breastfeeding, the diet, and certain oral habits. So that's something that you can look forward to receiving in your email, a video that you can watch on that. Okay, now I just want to answer a few questions that may have come up during the webinar. But at this point, I am going to go ahead and make the offer available. And so magically it will appear here. So go ahead and click on that if you want that coupon that we talked about earlier. But let's go over some of the questions that may have come up while you've been watching the webinar. And so the first one is, so if not braces, then what is worn? So with HealthyStart, what do they wear? And that's a great question. Instead of straightening the teeth with brackets and wires, it's appliances that are worn primarily at night. The appliances are soft, and HealthyStart overall I would say is a softer approach than braces. I describe the appliances as a pillow for the child's teeth. I actually noticed places in my teeth where the enamel sort of sheared off, and I didn't have them before braces, so I'm guessing it was the force of the braces that caused this. Another very common problem with braces is that the roots of the teeth will start to resorb or shorten because of the forces applied to them. HealthyStart treatment doesn't see any of these complications because it is a softer approach.
The appliances are much softer than metal, and since treatment is done earlier, while the teeth are erupting, not as much force is needed and treatment happens quicker. HealthyStart is based on 50 years of research and the experience of treating over 4 million children around the world, and they have over 500 patents. They are BPA, silicone, and latex free and are FDA approved. It is an all-natural treatment that is safe, pain-free, non-invasive, and very effective. Okay, so another question is, when is the appliance worn? And the appliance is mainly worn at night. Depending on the case, there may be some daytime wear, but this is usually only about 1 to 2 hours while they are reading, doing homework, or playing Fortnite. Okay, so let me introduce another appliance in the HealthyStart system, the guiding appliance. The guiding appliance has a template of where the teeth should go, and as it is worn, it guides the teeth into place as they are erupting. The guiding appliance usually requires what is called active wear, where the child bites into the appliance to help move the teeth quicker. Because the appliance is made to help guide the permanent teeth into the correct position, it is worn until all the permanent teeth have come into the mouth, which is usually about age 12 typically. Okay, so here's the guiding appliance, and you can see the template of where the teeth should go. Okay, another question that comes up is, why isn't my orthodontist doing this treatment? And that's a very good question. Now for this question, all I can do is guess at the answer. My best guess on this is that either it is hard for orthodontists to market to an earlier patient age, or I think a big one is that general dentists can offer this treatment just as well as orthodontists can, and in some ways it negates their further education. Now I'm not a conspiracy theorist, but it seems to me like they would have a vested interest in seeing something like HealthyStart not succeed. Okay, another commonly asked question is this the only treatment my child will need? And the vast majority of HealthyStart cases can be successfully completed without braces. But a very small number of cases, about 7%, may benefit from a brief, usually 2 to 4 months, stint in braces. And this is primarily to facilitate minor tooth rotations, what I call Hollywooding the smile. Okay, so now we've got a few before and afters that I wanted to show you. So it can help with any bite alignment issues like that first one and the second one. In the second one, there was quite a bit of misalignment that helped. And then the third one is actually an open bite. And I think these are pretty incredible what the appliances can do. And this is just the HealthyStart appliances, no braces were involved in this. Alright, I think congratulations are in order because you just made it to the end of our webinar. I do want to just go over, this is something that I'm going to be sending you as well through the email, just to make the webinar just a little bit shorter. I do think it's really good information. It's things that orthodontics can't fix. So if we wait until our child is 12 and 13 to kind of get started on their braces and moving their teeth, there are some things that orthodontists and braces that just have a hard time correcting. And just to give you a preview, you can see here with this picture that it's a lady with a gummy smile, and that's one of those things. And so I'll be sending you an email with a link to a video where I talk more about that, and I think I'll cover some pretty interesting things on that. So the only other thing to go over is to tell you which choir I'm involved in. It used to be called the Mormon Tabernacle Choir, but we just had a name change, and we're now called the Tabernacle Choir at Temple Square. And so I never do this, but let me just sing a little song for you to get you excited about coming in, meeting us, and starting on the HealthyStart treatment. Somewhere over the rainbow, way up high, there's a dream that you dream of once in a lullaby.